Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be discussing peptic ulcer. A peptic ulcer is a hole or open sore in the lining of the stomach, duodenum, beginning of the small intestine, or esophagus. Peptic refers to pepsin, a stomach enzyme that breaks down protein. An ulcer occurs when the lining of these organs is corroded by acidic digestive juices secreted by the stomach cells. Location of peptic ulcer. Ulcer may be found in the esophagus, stomach, duodenum, and jejunum at multiple levels, Zollinger-Ellison syndrome. Peptic ulcers occur in the stomach, gastric, or the duodenum, duodenal, or in both. Symptoms. Abdominal discomfort usually occurs in the epigastric area, upper middle part of the abdomen, radiating to the back, described as 1. A dull gnawing ache comes and goes for several days. 2. The pain may increase when the stomach is empty at night or half to 3 hours after a meal. 3. The pain is relieved by eating and antacid medication. 4. Weight change. 5. Fatigue. 6. Bloating. 7. Chest pain. 8. Burping. 9. Nausea and anorexia, common with gastric ulcer. 10. Vomiting, relieves episodes of severe pain due to evacuation of gastric acid content. Less common symptoms. 1. Constipation, and 5% of the patients with chronic duodenal ulcers have predominantly colonic symptoms. 2. Heartburn and eructation are also commonly associated with ulcer activity. Causes of peptic ulcer. While acid is still considered significant in ulcer formation, the leading cause of ulcer disease is currently believed to be infection of the stomach by bacteria called Helicobacter pylori, H. pylori. Stress increases the hydrochloric acid. Secretion. Chronic use of anti-inflammatory medications, commonly referred to as NSAIDs, non-steroidal anti-inflammatory drugs, H. pylori bacterium, Helicobacter pylori. The H. pylori bacteria excretes the enzyme urease, which converts urea into ammonia and bicarbonate. The release of ammonia, the acidic environment of the stomach, which explains the difficulty in destroying the H. pylori bacterium. Ammonia is toxic to the epithelial cells and damages them. Hence, the beginning of a stomach ulcer takes its course. Diagnosing H. pylori. H. pylori is diagnosed through blood, breath, stool, and tissue tests. Blood tests are most common. They detect antibodies to H. pylori bacteria. Blood is taken at the doctor's office through a fingerstick. Stool tests detect H. pylori. The Helicobacter pylori stool antigen HPSA test is accurate for diagnosing H. pylori. Tissue tests are usually done using the biopsy sample that is removed with the endoscope. Types of peptic ulcer. 1. Duodenal. 2. Gastric. 3. Esophageal. 4. Zollinger-Ellison syndrome. Severe. Peptic ulcer plus gastric hyperacidity, gastrinoma, islet cell tumor in pancreas. 5. Curling's ulcer, duodenal ulcer. A duodenal ulcer is a type of peptic ulcer that occurs in the duodenum, the first part of the small intestine. It's characterized by a sore or lesion in the duodenal lining, often caused by common causes. 1. Helicobacter pylori, H. pylori infection, a bacterial infection that can cause inflammation and ulcers. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Long-term use of NSAIDs can irritate the duodenal lining, leading to ulcers. Gastric ulcer, A gastric ulcer is a type of peptic ulcer that occurs in the stomach lining. It's characterized by a sore or lesion that can cause pain and discomfort. Causes: 1. Helicobacter pylori, H. pylori infection, a bacterial infection that can cause inflammation and ulcers. 2. Nonsteroidal anti-inflammatory drugs, NSAIDs. Long-term use of NSAIDs can irritate the stomach lining, leading to ulcers. 3. Excessive acid production. High levels of stomach acid can contribute to ulcer formation. Esophageal ulcer. An esophageal ulcer is a hole in the lining of the esophagus, corroded by the acidic digestive juices secreted by the stomach cells. Lower section of the esophagus. Esophageal ulcers are not contagious. Ulcers may cause iron deficiency anemia. Esophageal ulcers may be a symptom of another disease or condition. Bleeding from the esophagus is often associated with chronic GERD. Zollinger-Ellison syndrome. A large amount of excess acid is produced in response to the overproduction of the hormone gastrin, which in turn is caused by tumors on the pancreas or duodenum. These tumors are usually malignant, must be removed, and acid production must be suppressed to prevent the recurrence of the ulcers. Curling's ulcer. Curling's ulcer is an acute peptic ulcer of the duodenum resulting as a complication from severe burns when reduced plasma volume leads to sloughing of the gastric mucosa. These stress ulcers were once a common perforation and hemorrhage, and had correspondingly high mortality rates. Bleeding. As an ulcer erodes the muscles of the stomach or duodenal wall, blood vessels may also be damaged, which causes the bleeding. Over a period of time, the patient becomes anemic. Can be treated endoscopically by locating the ulcer and cauterizing the blood vessels with a heating device or injected with material to stop bleeding. Perforation. Sometimes an ulcer eats a hole in the wall of the stomach or duodenum. Bacteria and partially digested food can spill through the opening into the sterile abdominal cavity, peritoneum. This causes peritonitis, an inflammation of the abdominal cavity and wall. Immediate hospitalization. Complications of peptic ulcers. Blood vessels are damaged as the ulcer erodes into the muscles of the stomach or duodenum. An ulcer can erode through the entire wall. Bacteria and partially digested food spilled into the peritoneum equals peritonitis. Management. Lifestyle modification. Hyposecretory drug therapy. Surgery. Surgical treatment. Indications: failure of medical treatment, development of complications, high level of gastric secretion, and combined duodenal and gastric ulcer. Principle: reduce acid and pepsin secretion. Types of surgical procedures. Gastroenterostomy creates a passage between the body of the stomach and the small intestine. Allows regurgitation of alkaline duodenal contents into the stomach. Keeps acid away from the ulcerated area. Vagotomy cuts the vagus nerve. Eliminates the acid secretion stimulus. Pyloroplasty widens the pylorus to guarantee stomach emptying even without vagus nerve stimulation. Antrectomy, subtotal gastrectomy. The lower half of the stomach, antrum, makes most of the acid. Removing this portion, antrectomy, decreases acid production. Subtotal gastrectomy removes 2/3 of the stomach. The remainder must be reattached to the rest of the bowel. Oidice Billroth L. Billroth Sekung. Billroth 1. The distal portion of the stomach is removed. The remainder is anastomosed to the duodenum. Billroth 2. The